Welcome Saadiq and Ashraf, thank you for coming to join us.
Thank you for inviting us.
And to tell us about this mobile app that you've created, Mobile Xhosa, Mobile Zulu.
Okay, yes, so our websites and mobile apps, Mobile Xhosa, Mobile Zulu and Mobile Translate MD, they are designed to help medical students and doctors to communicate with their patients in other languages. Obviously South Africa has many different languages, 11 official languages, as well as the many languages spoken by immigrants and refugees in South Africa. And most of our doctors only speak a couple of those, and most commonly English and Afrikaans. So we have a lot of language barriers in our healthcare system, and this affects the healthcare that our patients receive. So this is just one solution that we're putting forward to help overcome this problem. It's supposed to work hand in hand with translators, with education of healthcare providers, to altogether overcome this problem. Specifically, our website and app, it contains commonly used phrases, over 600 at the moment, that medical professionals use in communication with their patients. So it provides the English and the translation in a number of different languages. At the moment we have Xhosa, Zulu, French, Spanish and Afrikaans, and it provides the English and those translations, so it helps the doctors to communicate from taking history, examining the patient, all the way up to the end when they want to give the patient health promotion or prescribe medication, or even to get the patient ready for surgery.
And am I right that you as a Xhosa worker recognise this need?
Yes, so as a medical student and working at Xhosa, obviously I had a lot of exposure to patients, and patients who didn't speak the same languages that I do. So I couldn't remember everything we learned in med school. Obviously we do have language education, but it's very difficult to remember everything. And I just realized for myself that having a phrase book available to me all the time would just be so helpful, and it helped the patients as well. So that's where I got the idea from.
I was going to ask that question, could patients use your website to assist them in communicating with the doctor?
Well, primarily it's aimed at medical doctors, because they are the people asking the questions. It's ideally for the doctor to be asking the patient's language rather than the other way around. But obviously it is something that is helpful for patients to know about, so that if they're having difficulty communicating with the doctor, they could always tell their doctor and try to use it to help themselves.
Thank you. And Ashraf, you've been helping Saadiq as an actuarial student. Can you tell us a little bit from your side what it's been like?
So I was the programmer of the Android app. Previously we just had the websites Mobile Xhosa and Mobile Zulu. And so we decided that it was important to have an app because there's quite a few advantages of an app over websites. And so we released that app over in January this year. And so I was actually quite surprised when I was first working on this app by how big a need there is actually for a solution to language barriers. There's quite a lot of research that's been done into it, and if you look at the statistics, you'll find that there's lots of people who don't speak the language that their doctors are communicating with them in. And the solutions that are used are often not good enough. So for example, they'll get a translator who could be a maintenance staff or a family member, and then obviously that's a breach of doctor-patient confidentiality. And there's other problems like that as well. So I felt that it was quite useful work that I was doing.
For sure, thank you. A good partnership. And the fact that we are now using mobile technology to assist in healthcare and access availability, where do you see this moving?
Okay, I think mobile technology in healthcare is probably it's just going to get larger and larger. The technology, it just makes information available very quickly. We're starting to see this more and more, so even with more traditional things like computers, x-rays are no longer on paper but they're available on computer. Even in some hospitals, patients' notes are now available on computer instead, so they're just available wherever you need them, and they also don't get lost all the time. And aside from that, medical information like textbooks and so forth is also being digitalized. So doctors always have that with them. You don't need to carry around 10 books in your bag. You've got everything on your tablet or your phone, which is much more convenient as well.
For sure, the handiness of it.
Yes.
I think as well, in terms of students, an app is a lot more appealing than a book, for example, and it's obviously more mobile. So if you wanted to, for example, revise a phrase, you wouldn't have to have your textbook with you. You could just have your phone and you'd be able to do it.
Right, and when you're a doctor, medical student, you never know what language that person has when they come into your door.
Yeah.
So the app, you just click according to the need at the time, which is very helpful. And I see you've used a Creative Commons license, so you've been decided to share your work openly with others. Can you tell us about your choice of going open?
So the Creative Commons license allows anyone to reproduce the work. We just want the information to be available. The more people that have access to it, it doesn't matter who you're really getting the information from, but the more doctors and medical students that have access to the information in whatever form, the better it's going to be for all our patients in the end.
And that really is the that openness and sharing of your knowledge, which is so helpful.
Yeah.
Thank you. I also recognize that you used other departments in the university, the other faculties. You come from the health sciences faculty, you come from actuarial, and you engaged with the languages department?
The African languages department is probably one of the department that actually inspired this whole thing. They started teaching us languages in first year already, and it's really kind of that inspired me to do all of this. When I did start doing it about 2 years ago, I approached one of the lecturers, and I think he immediately saw that this could be something quite important and changing for patients. And he's always encouraged me and helped me with translations, putting me in contact with other people, just to help this thing grow.
Wonderful to have that leadership and partnership too. Thank you. And just your future plans before we end? What's in store?
Future plans? Well, we're always looking to add more content, whether it be more history taking, but especially what we'd like to expand into is health promotion aspects, so giving doctors scripts to read to patients in their own languages, so that people actually understand the health promotion instead of just nodding when you speak to them in English. And then there's also the medical legal issues, so when doctors need to take consent from patients for a procedure. We've got one example of that at the moment is for cesarean sections, which happens quite commonly.
Yes.
And now if you're able to consent the patient in their own language, I think that will make quite a big difference. It also avoids medical legal pitfalls. Then we're looking to expand to other languages as well. We're at the moment sitting on 5, but there's a lot more languages spoken in South Africa, so we've still got a long way to go there. Then we also at some point would like to get other disciplines involved, so occupational therapists, dietitians, physios. They're all experiencing the same issues that we experience as doctors.
Yes.
And at some point we'd like to also move into that. The last thing I think is just to get into the Apple App Store as well, so that everyone can access the app.
That would be great.
And Windows as well. And there's also a few features that we'd like to introduce into the app that aren't there yet. So, for example, we've got audio output where you can press a phrase and hear how the phrase is pronounced in French and Spanish right now. But we haven't got that supported for African languages yet. So that's something that we would like to do. And we'd also just like to be able to streamline the process so that it's less of an interruption to your interaction with the patient, where you have to use your app and then talk to the patient. We'd like to make that a lot easier to use.
Right, to save time and to make that interaction and relationship easier.
Yeah.
Wonderful. Well, guys, thank you very, very much for sharing, and congratulations on a wonderful tool that you've developed and are now sharing with everyone.
Thank you.
And I think it will go a long way towards promoting health and human rights for many people.
Thanks.
So
We hope so too.
congratulations. Thank you. Saadiq, this app sounds incredibly useful for so many doctors and medical students. Can you please show us how it works?
This is the Mobile Translate MD app that's available on the Google Play Store and BlackBerry World. When you first open the app, it takes you to the initial menu where it shows the different parts of the consultation. So starting at history and examination and ending at prescribing medication, giving the information, health promotion, and the various procedures. So say we're at the start of the consultation and we want to take a history from the patient. We could select that option and then it gives you various options. So if we want to ask the patient why they come, we'll ask about the presenting problem. And once you get to the page, it then gives you the English and the translation in whichever language you want. So for instance here, it tells you how to ask the patient what's troubling you, what's brought you to the doctor, and so forth. For Xhosa at the moment, we don't have any audio support, but in some of the other languages like French and Spanish there is. So this is how you change languages, and then you can, if you have difficulty pronouncing in whichever language you're using, the app can ask the patient the question for you. The last thing that is also available is some pronunciation help. So if it's a new language for you, there's links to various websites and YouTube channels that can teach you a little bit about the language and how to pronounce in the language. And then as you get towards the end of the consult, there's also options for giving the patient information. So if a mother's brought a child in with diarrhea, you can explain to the mother how to make ORS for the child, and we'll give you all the list of instructions that you need to tell them.
Thank you. And your app is in progress. You are planning to get more audios.
I think this app's going to be in progress for a long time as we add more information and languages and audio as well.
We're also working on things like the user interface, so hopefully it will look a little prettier and be a little more intuitive to use in the future.
Excellent. Thank you so much.